Today we shall talk about Wood's lamp examination, which is a very important bedside examination frequently practiced in dermatology. It was introduced first by Robert W. Wood. He was the person who started Wood's lamp examination. It is a mercury vapor lamp that emits long UV radiation, which is generated by high pressure mercury arc fitted with the Wood's filter. So we have this Wood's filter inside this device, which will help in emitting a certain wavelength of light, which will help in detecting certain lesions of skin. And this Wood's filter is made up of barium silicate and 9% nickel oxide. This is the composition of the Wood's filter here. Okay. There's absorption of one wavelength and emission of another longer wavelength, which gives us the fluorescence. So here is the Wood's lamp device. Here you can see the device. The device looks like this. There's this handle to hold it, and then to see it like this, we have the eyepiece here. Through this we can see it. The lesions have to be examined in dark rooms, but if there's no availability of dark rooms, then we can use this dark cloth or black cloth to cover the lesion and see it. So a completely dark room is required for examination. Examiner also should get adapted to the dark light before he examines. The lamp also should warm up for 1 minute before examining. Light source should be 4 to 5 inches away from the lesion. So you have to hold the Wood's lamp at least 4 to 5 centimeters away from the lesion for it to be seen properly. Remove any material which is interfering with the fluorescence, like any fiber or soap residues if it is there, or topical medicines. So if the patient has applied any topical medicines, if there's any clothing on that, everything has to be removed, and then you have to examine it. So applications in dermatology, here we use it in certain conditions. So firstly, we use it in tinea capitis. Tinea capitis is fungal infection, superficial fungal infection of the scalp, right? And tinea capitis most commonly is seen in children, but adults also can have if they're immunocompromised. So it's a dermatophytic infection. Here we see blue-green fluorescence. So the color here that we see is blue-green fluorescence which is seen here, and this fluorescence is seen because of the pigment pteridine. So the fungus produces the pigment called as pteridine, and because of this pteridine pigment we can see the fluorescence. So all of these pigmentation only produces the fluorescence. That's why we use Wood's lamp to examine those lesions. Okay, and it is only seen in tinea capitis, but it is not seen in corporis or cruris because this pigmentation is not produced again. Fungi with the dermatophyte which causes tinea capitis and tinea corporis cruris are different. So therefore this fungi will produce pteridine, and that's why you can see the fluorescence. Next disease is pityriasis versicolor. It's again a superficial fungal infection which is caused by Malassezia. Okay, and here we see yellowish white fluorescence. So the fluorescence here we see is yellowish white in color, and here again the pigment is because of Pityria lactone. In pityriasis versicolor, we see both hypopigmented and hyperpigmented macules we see, which are slightly scaly macules, mostly present on the sebaceous areas, that is the face, the neck and the upper chest, upper back. In these areas it will be present. Hypo and hyperpigmented macules would be present. They are usually asymptomatic, and sometimes they can be associated with pruritus, can be very rarely seen, and that is pityriasis versicolor. And here we see yellowish white fluorescence, and that is because of Pityria lactone. Next is Pseudomonas. In Pseudomonas infections also we can see fluorescence. Pseudomonas can cause Pseudomonas folliculitis, hot tub folliculitis, or it can cause ecthyma. So in these, or it can also cause green nail syndrome. These are the dermatological manifestations of Pseudomonas. To repeat again, Pseudomonas can cause Pseudomonas folliculitis. It can cause hot tub folliculitis, or also called a swimming pool folliculitis, or it can cause ecthyma. Both ecthyma and ecthyma gangrenosum can be caused by that. Here we see green color fluorescence. In Pseudomonas infection we see green color fluorescence. Right. The next disease is erythrasma. Erythrasma is a bacterial infection caused by Corynebacterium minutissimum. And here we see coral pink fluorescence. It can be sometimes red also. And here it is due to the pigment coproporphyrin. Corynebacterium minutissimum, right? This is the organism which causes erythrasma. Hypo and depigmented disorders. Even hypo and depigmented disorders can cause, there can be a pigment difference that you can identify. That's why it is used in hypo and depigmented disorders of skin also. Here we have vitiligo, tuberous sclerosis, nevus depigmentosis, nevus anemicus, and chemical leukodema. So vitiligo is a depigmenting skin disorder. There's a difference between hypopigmentation and depigmentation. I've told you before also. Hypopigmentation is wherein the pigmentation is slightly reduced than the normal skin color, whereas depigmentation, it is fully reduced. Like here it will be, in depigmentation it will be milky white almost, but here it will be just lesser than the surrounding skin pigmentation be present. And depigmented is characteristically seen in a condition called as vitiligo. Okay, so here it is because of destruction of the melanocytes. In vitiligo there is depigmentation because of the destruction of the melanocytes. So if these melanocytes are destroyed, if there is disappearance and destruction of these melanocytes in the skin, they give rise to a condition called as vitiligo, wherein you see depigmented macules. That is, there'll be flat lesions which are depigmented. They would have completely lost their pigmentation. So milky white patches you see in vitiligo. That's a condition which you can identify. It can be appreciated better in Wood's lamp. Right. Next, we have tuberous sclerosis. Tuberous sclerosis is again a genodermatosis. Here, it's a genetic disorder. Okay. Here, the patient can have so many manifestations are there. Here, he can have neurofibromas. He can have Conan's tumors, adenoma sebaceum, or shagreen patch. There are many things, or even cafe au lait macules. So all of this can be identified. Especially these pigmentary changes like cafe au lait macules can be appreciated and identified by Wood's lamp examination. Then we have nevus depigmentosis. As I have told you before, again, nevus need not always be hyperpigmented or blackish in color. It can be depigmented also, and one such example is nevus depigmentosis. And here also you can appreciate the lesion better. Nevus anemicus, the difference between nevus pigmentosis and anemicus is, in nevus anemicus there will be hypopigmented because of vasoconstriction of the vessels, which is caused by catecholamine release. That is nevus anemicus, right? Here it is because of nevus depigmentosis is melanocyte, whereas here vasoconstriction of vessels causes hypopigmentation is nevus anemicus. That can also be appreciated. Chemical leukodema, again, leukodema means whitening of the skin. Chemical leukodema means chemical induced whitening. So here it can be, for example, because of Indian women use bindi on the forehead, right? They wear bindi on the forehead, and bindi will have para-tertiary butyl phenol, and because of this para-tertiary butyl phenol, the chemical release causes hypopigmentation there. So that is chemical leukodema, which again can be appreciated. So pigmentary disorders also can be appreciated in Wood's lamp. Next, not only hypopigmented, even hyperpigmentary disorders can be appreciated. Here we have freckles, which are the hyperpigmented spots which are present on the face and sun exposed areas. We have nevus aorta, which is a kind of nevi. Then we have melasma, chemical peel usage. So all of this also can be appreciated. We have a metabolic disorder called as porphyria, wherein porphyrin levels are increased, and that also can cause red or pink colored fluorescence under Wood's lamp. Urine and blood also can be examined here. Then we have acne vulgaris, a common condition that most of us have faced. So this acne vulgaris also can cause fluorescence of orange reddish colored fluorescence it can cause, and that is seen only over the comedones because of coproporphyrins. Even a parasitic infection, that is arthropod infections, scabies. So these burrows are present in the web spaces and in the wrist and in the groin area. Wherever it's infected, it will be present. So that also can be appreciated by Wood's lamp. Even drug deposits can be noted. Drug deposits, especially tetracycline deposits, causes yellowish color. Tetracycline can deposit in the teeth, which can cause yellowish discoloration. Next, we have chrome hydrosis. Here, because of the lipofuscins present here, it can be appreciated better. Different colored sweat is seen. That is lipofuscins which are released in the sweat, and that can be appreciated better in Wood's lamp examination. Next, we have squamous cell carcinoma. Even squamous cell carcinoma of the skin can give red colored fluorescence. That is seen in Wood's lamp examination. Next, we have photodynamic diagnosis of pre-malignant and malignant conditions of skin. That can be done by applying amino levulinic acid to the tumor for 4 to 6 hours under occlusion. You apply this topical amino levulinic acid to the tumor and then observe it on the Wood's lamp after 4 to 6 hours. You can appreciate it better. Here you can see a case of tinea capitis with blue-green fluorescence, and this is pityriasis versicolor. You can see there's multiple hypopigmented macules here. Here we see pale yellow fluorescence. This is a case of erythrasma which shows coral pink or coral red fluorescence. Here in the interlentiginous areas, you can see the fluorescence present.
Here you can appreciate the depigmentation better. It's a case of vitiligo, so you can see a depigmented patch on the back, but on the front of the chest. Whereas, but you can appreciate the depigmentation better when Uts lamp is thrown. And here is a case of porphyria, wherein you can see the red pink color of the urine, which is turned in that color because of the copper porphyrins present in the urine.
Here, this is the erythrasma here. When you see coral pink fluorescence, you see here erythrasma. This is erythrasma, right? Advantages of Woods lamp is it is a simple investigation. It is non-invasive, and it does not cost anything. It's a cost-effective investigation and portable tool. You can take it around, right? And various diagnoses can be confirmed by using Woods lamp examination. So, since it's a very advantageous investigation, it is very frequently practiced. Disadvantages is most of the fungi of tinea capitis do not show fluorescence. So you sometimes when you do in a case of tinea capitis, if you don't find fluorescence, it does not rule out that the patient does not have tinea capitis. Even still, if the fluorescence is not present, even then the patient can have tinea capitis, right? And reflection of light from any scaly dermatosis can be confused with prevesicular. Optical brighteners are there, and erythrasma. While examining that, if the patient is washed and come to you, you cannot appreciate the fluorescence then. So it's important to consider all these factors before examining the patient with Uts lamp.